Hi everybody, this is Dr. John Ganino and I wanted to share with you a recent miracle case at our office. This is a young lady, 41 years old, who came in with a diagnosis of stage 3C ovarian cancer. Of course, this means that the cancer started in her ovaries and it's now metastasizing. As you may know, one of the ways we follow people with cancer, they're called tumor markers, they're blood tests. So this lady came in with a CA-125. It's a marker for ovarian cancer at 72, high normal's 34. She'd already had surgery, but she had prayed about it and she decided that she didn't want to do chemotherapy or radiation, but she came to me saying, hey, how are we going to manage this metastasis? And I said, okay, well, we have a wellness program. Let's put you in, let's strengthen your body, let's detoxify your body, and let's see what happens. And I said, what I'd like to do is recheck your CA-125 in about 12 weeks. So she's enthusiastic and takes off, starts doing the program. She's feeling well throughout, and she came back in 6 weeks, and she had her daughter and her 11-year-old daughter and her 8-year-old son with her. And I said, how are you doing? She said, I'm doing great. She said, no disrespect, Dr. G, but I really want to recheck that tumor marker now. And I said, well, to be fair to the program, I really think we should give it, 12 weeks. She said, I have my daughter and my son. She said, I just don't, I'm scared. Honestly, I'm scared. And I want to make sure that what we're doing is moving me in the right direction, because if not, I want to seek a second opinion. I said, okay, fine, let's go ahead and let's do it. So we drew the blood test, and I saw her back about a week later, and I'm all excited because I know the answer. And I walked into the room, and she confessed. She said, I'm hoping and praying that this number is in the 40s. Again, remember, started at 72, normal being 34 or less. Her prayer was that the number was in the 40s or better. And I was happy to report to her on that date that her tumor marker was 15. So anyway, I thought that was great, and so I wish her well, and she's continuing to do well. This is probably about 2 months after we had that conversation on that day. She's still doing great. So I wanted to just pass that along, and it's just I thought a wonderful case to show how injured tissues can heal with nutrients, not drugs, and that people with cancer can heal and get better and have their cancer shrink and their tumor burden become less without chemotherapy and radiation. So I hope you enjoyed that segment, and hope we'll have more for you in the future.